This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Tiomist Respicap is a medication used for managing chronic obstructive pulmonary disease. This bronchodilator helps patients breathe easier. Indications and uses. This medication is indicated for the maintenance management of chronic obstructive pulmonary disease, COPD. It helps to alleviate symptoms associated with the airflow limitation characteristic of this condition, enabling patients to engage in their daily activities with more ease and comfort. The use of this medication is particularly beneficial for those who experience persistent cough, phlegm production, and difficulty breathing. How it works. It works by opening the airways, facilitating easier airflow in and out of the lungs, thus helping to minimize the effects of COPD. Directions for use. Use this medication as directed by your physician. It is intended for inhalation only and must not be swallowed. Care should be taken to avoid contact with the eyes, as it can lead to blurred vision and discomfort. Your doctor will determine the appropriate dose based on your specific circumstances, including age and weight. It is essential not to discontinue use without consulting your healthcare provider. Possible side effects. Common side effects include dry mouth, while less common effects can include dizziness, headache, and throat inflammation. Serious side effects may involve allergic reactions and increased eye pressure. Precautions and warnings. Before using this medication, it is important to inform your doctor about any existing health issues, especially kidney problems or a history of heart disease. Special caution is advised for pregnant and breastfeeding women, and it is not recommended for individuals under 18. Avoid using this medication if experiencing sudden breathlessness or wheezing. FAQs. 1. Can I use this medication for sudden breathing problems? No, it is not a rescue medicine. 2. What if it accidentally gets in my eye? Rinse your eyes with warm water and consult your doctor. 3. Can I stop using it if my symptoms improve? No, always consult your doctor before stopping. 4. How does it work? It opens your airways for easier airflow. 5. Is it safe for infants? No, it is not recommended for children under 18. Thank you for watching. If you have any questions or suggestions, please leave a comment below.